Heading into another pandemic winter, it's hard to predict the road ahead. But experts insist we could be navigating some really hard turns. While we can't see whether a brand new variant is around the corner, we do know hospitalizations are rising, new Omicron subvariants are spreading, and uptake of the latest booster is slow.
In healthcare terms, the next 2 or 3 months are likely to be really challenging again.
This is what it looks like inside Humber River Hospital and many other ERs right across the country.
It's one patient after one patient after one patient after another. It's kind of hard for us to take a break for a moment to pause.
Add to that, in the southern hemisphere, Australia saw one of its worst flu seasons in years. And the U.S. is already reporting an early surge in flu cases.
You're seeing a tidal wave sweeping across this country right now.
Here at home, the number of children landing in ERs sick with viral illnesses is already spiking. And of course, there's COVID. The number of Canadians now hospitalized with COVID-19 is around 4,000. That's almost twice as many as last year, 4 times more than in 2020.
If things going the way we're going, that there'd be more volume, more pressure on colleagues and nurses.
At the same time, new variants are emerging around the globe.
There are now new Omicron subvariants circulating that are more immune evasive, unfortunately, and potentially more transmissible.
Meaning new variants could drive new COVID waves as people move back indoors. Still, Canadians can avoid crowded emergency rooms by masking indoors, staying home when you're sick, and getting the latest booster. And Rasmussen and other experts insist provinces do not need to make people wait 6 months before getting their next shot.
If you can wait at least 4 months, essentially you're giving your immune system time to sort of absorb everything it learned during its last encounter with either a vaccine or the virus itself, and it's ready essentially to learn more about Omicron.
But experts insist if Canadians can slow down and remember what's been learned, we can safely navigate the pandemic road ahead. Christine Birak, CBC News, Toronto.
So there are always more questions when it comes to COVID, when it comes to a moment like this. So here to help us sort them out, infectious diseases specialist Dr. Susie Hoda. Thank you. Very nice to see you right here in person. Lots of worried doctors. Are you one of them?
Yes, I am concerned. Every year in the fall and the winter, we see a rise in admissions and hospital, and most of that's due to respiratory viruses and their complications. And this year, we've got COVID-19 circulating, and we've got other respiratory viruses that are going to make a comeback, likely. And so we don't really know what that's going to look like. We could see, them superimposed or one after the other. Regardless, it's likely to strain the system, and I worry about that in terms of access for patients.
If I'm sitting at home and I am worried, and I'm worried about kids in particular, which is the one to be most worried about, COVID or these respiratory viruses?
Well, the chances of encountering COVID are definitely higher right now because there's so much more of it than some of the other respiratory viruses at this moment. But when we're talking about children, it is important to recognize that most kids don't get too sick from COVID-19 unless they have underlying health conditions. Of course, that might be a special situation. We do know that influenza and respiratory syncytial virus, or RSV, can cause serious illness in kids, and so I definitely watch out for that. The good news is we do have a vaccine for influenza, which is readily available to all Canadians in the fall. So,
okay, vaccines. Let's talk about those for a second. Christine said something interesting in the piece that booster uptake is low. What's happening there? Are people worried that the bivalent maybe doesn't deal with the variants enough? Is there an element of, I don't want to feel miserable for another day or two, I've had so many vaccines already?
I think there is an element of COVID vaccine fatigue that we're all struggling with, across the age groups. That said, I think it's so important for the point to come across that any booster dose that you would get is going to improve your chances of getting through a COVID-19 infection without getting seriously ill. And the bivalent vaccines are very safe. I have not seen any signals that have been concerning with them. They may not be a perfect match to what's circulating around right now, but your chances are greater, and we're seeing a lot more COVID-19 picking up. So now is a really important time for senior citizens who are seeing more COVID-19 again, and everyone to get up to date with their booster vaccines.
One last thought, hand washing. We didn't talk about it as much during the last couple years once it was established that COVID was largely airborne. Do we need to start talking about it again?
Absolutely. I mean, it should never have left the conversation, in my opinion. First of all, it's dangerous to just focus on one pathogen. There are other infections that have been rising through the pandemic, things like antibiotic-resistant organisms, and these are transmitted by contact. So hand washing is very important. But also other respiratory viruses outside of COVID-19, they're transmitted by respiratory route and through contact. And so it is important to continue keeping a focus on hand washing now and actually into the future.
All right, Dr. Hoda, so nice to see you. Thank you for that.
Thank you.